Mary McInerney from Croaky here at the International Medical Regulation Conference, and I'm talking to Kieran Murphy, who is, what's your title?
So I'm a member of the IAMRA Management Committee and a former president of the Medical Council of Ireland.
Right. Now, we wanted to talk first up about the issues that are on the regulation agenda in Ireland. What would you say, from the patient's perspective, are the big issues there?
I think really the big challenge for Ireland relates to making sure that doctors are enrolled in professional competence schemes and that they meet their expectations from those schemes. All doctors are required to participate in continuing professional development, CPD, but there's been a difficulty in trying to get all doctors to engage, and also there are challenges with how we might deal with doctors who don't actually fully engage in the process.
What are the difficulties there?
The difficulties are that although it's a legal requirement, not all doctors have signed up to these schemes. These schemes were brought in about 5 years ago, and currently the Medical Council of Ireland is trying to work out how best to deal with significant numbers of doctors who haven't signed up.
How does Ireland compare then with other parts of Europe and the UK? It's not being part of the UK, of course.
Yes, indeed. So I suppose in the UK they have rolled out a new model over the last couple of years, which is called revalidation, which is that all doctors within the UK have a period of assessment, an external assessment. So Ireland doesn't have that, but certainly within mainland Europe there are varying degrees of and different models of medical regulation within Europe. A whole range of different models are used within Europe for the regulation of doctors. I think probably Ireland, the UK, Australia, Canada and North America have broadly similar models for medical regulation, but I think within Europe and indeed within Africa, South America, and Asia is quite different, and there are lots of different models that are used in medical regulation.
And are there particular problems then for doctors in Europe to be able to cross jurisdiction?
Yeah, so a lot of different medical regulatory authorities share information sort of proactively. So for example, Ireland and the UK have a very well established channel of communication. One of the difficulties in Europe is that there is freedom of movement, and so there's no bar to accessing for doctors to move within the EU. This can be a challenge for the regulators because of the problems with language. Within Europe we're not allowed to test for English language, which is a difficulty for doctors moving to Ireland or the UK.
You just chaired a session on impairment, doctors' impairment. What were the main issues that came out of that?
Yeah, so I think there was a very interesting session. There were 5 different speakers. I think the key, actually that came out of the session was that for doctors going through disciplinary procedures via complaints, it puts an enormous psychological burden on those doctors. They find it very stressful, and what the GMC, one of the talks was from the GMC in the United Kingdom, which actually is now trying to develop processes to offer supports to doctors during the process, because it's a very stressful experience for doctors to be the subject of complaints. And that led on to a further discussion about how we educate our doctors, and I think that traditionally doctors have been educated to be always right, a fountain of knowledge, and always healthy, and not patients, and never patients. And so it's difficult for medical students and for doctors generally to admit that they're not perfect and that they are not, and if they have illnesses. And in fact, a number of people had a discussion at the session that I chaired with regard to how we can deal with that. And I think one of the difficulties that many people feel is that because of how we educate doctors, that we need to ensure that doctors understand that they need to look after their own self-care as well, and that it isn't, and that if they don't do that, then the risks of burnout and the really development of more serious psychiatric illnesses may evolve if they don't deal with their own mental health themselves.
Raises a lot of cultural issues, and we were talking before that those similar ones were raised here with the Royal Australian College of Surgeons' work on bullying and harassment.
Right.
Where do you see that positive?
Yeah, so in fact, with the Medical Council of Ireland, they actually recently published a report on this medical workforce in Ireland, and they found high levels of bullying. And that's really consistent with what other jurisdictions have found also when they've looked for it. And I think that it's about trying to educate doctors that it isn't acceptable, and to encourage doctors to actually take action when they're placed in situations in which they are this subject of bullying. It's also alerting employers that it's unacceptable for doctors to be put in these positions, and to ensure that actually as a regulator we can work with both doctors and employers to ensure that such a culture is stamped out.
I would love to keep talking, but we have to race into the next session. Thank you very much.
I hope that was